So firstly, it's a pleasure to have you here at Nova. It was a really nice presentation, and we would like to ask you if you could give us a little summary of your research, the main findings, what's the question, the methodology.
Okay. So the general question is how to improve sanitation in an urban environment. When the improved sanitation technique is more, especially in a case where the improved sanitation technique is more expensive. And so this work was funded by the Gates Foundation, and they wanted us to work on two different dimensions. So one side is how can we get individuals to have a higher willingness to pay for these sanitary techniques. And then the other question is on the supply side, how do we get the suppliers of the sanitary technique to offer a lower price? So in this case, the technology is desludging of pits. So they fill up every 6 to 12 months, and people have to somehow get rid of the sludge. It's very expensive if you want to pay a truck to take it far away. Otherwise, you can just shovel it out yourself or pay somebody to shovel it out, but that's much cheaper. So on the on the demand side with the households, the idea is how to get the households to be willing or able to pay more. And then on the supply side, there is a feeling that these truckers have some cartel power and keep the prices artificially high. And so how to get them to lower their prices. And if we can both get the suppliers to lower their prices and the households to be willing to pay more, maybe we can get more people willing to adopt the better technique. So on the demand side, there were a few pieces. One I did not present today was trying to help people save using mobile money. If the reason that people don't buy this sanitary technique, this mechanized desludging, is because they don't have money available at the time, because it costs a lot of money, and usually when you need to do it, your pit fills up, it gets full, and then you need it immediately, you can't wait. So if you don't have money saved up, then you basically have to do the cheaper thing. So we had different mobile money options that we gave people to save, hoping that we could convince people to save more by making it easy. In the end, those interventions did not really have any impact. So the mobile money savings accounts, people all were excited about them when we gave them, but then people didn't really use them. And even the people who did use them, they seemed like they were people who would have bought the more sanitary technique anyway. Mobile money did not convince new people to use the more sanitary technique. So in addition to the mobile money to help people save, we also tried to harness social interactions, either learning from friends or getting pressured by friends or by neighbors, really, to do this. And so we had a bunch of different interventions where we either told people the prices that each other were offered, because we had randomized prices, or told people which of their neighbors adopted or how many adopted, trying to encourage some social pressure or encourage some reciprocity or encourage some learning, coordination. Again, none of those social interventions seemed to work. And then on the supply side, we did try to lower the price through these auctions we ran. Anonymous auctions, which we were hoping would kind of break the cartel power of these sludging truckers. And we do see some suggestive evidence that the prices did go down with the auctions. That I didn't really show today. But if you compare the auctions to what people were getting in the open market, it does seem like there was an effect of the auctions on lowering prices, and potentially due to breaking the cartel power.
Perfect. So you would say that the policy implications would be more regarding the supply side than the demand side? Or?
I guess maybe the policy implications is that price is key. I guess that's obvious. We're economists, so whatever you can do to lower the price, if that has to be subsidies, fine. If you can lower it by auctions and breaking cartel power, fine. But for these technologies that have a lot of health externalities, in an urban setting, price seems to be the most important factor. So other research in rural areas has shown you can use more of these social factors to push people, but they don't seem to work as well in an urban setting.
Okay, and how do you think further research could contribute to this topic, if you have anything in mind?
Yeah, I mean, I would love to see more done on individuals' beliefs. I mean, something Pedro was asking about, individuals' beliefs about how sanitation affects health outcomes, and individuals' beliefs about how the distribution of adoption affects outcomes. And by distribution, I mean, like, so one thing is there a threshold effect, which epidemiologists have said perhaps there is, like, you need at least 30% of the households to clean up for there to be an improvement in health. But a different question, whether or not that exists, a different question is whether the people who live there believe there to be a threshold effect. And so I would love to see more research on beliefs, and I guess you guys here at Nova Africa have a lot of people who work on beliefs and belief formation, so that would be one interesting area.
Perfect. So thank you very much.
I have one other last plug.
Sure, please.
So there, if you
Sorry
want
to interrupt you.
If you want to look, there was so I don't know, in the US there's this podcast called Planet Money.
Yeah.
And they did like a 15 or 20 minute podcast on this project. It's called the Poop Cartel, like poop.
Yeah.
Poop Cartel. And so it's fun to listen to if you want to.
Sure.
More about it.
Sounds super good. Thank you very much once again. It was amazing to see your presentation and to have this talk.
Thank you. Thank you for having me.